Hello everyone and welcome to the GI Endoscopy Author Interview Series. I'm Sonmoon Mohapatra, having recently completed my Advanced Endoscopy Fellowship at the Mayo Clinic in Arizona. I'm now a consultant gastroenterologist and advanced endoscopist at the Sai Institute of Gastroenterology and Liver Sciences in India. On behalf of my co-authors and our mentor, Dr. Namring Fong, I would like to thank ASGE and the editors of GI Endoscopy Journal for giving me this opportunity to discuss our recently published article titled Predictors for Lymph Node Metastasis and Survival of Patients with T1B Esophageal Adenocarcinoma Treated with Surgery and Endoscopic Therapy, an analysis of the SEER database. Let's delve into some background information. Currently, there is limited data on the long-term outcomes of the endoscopic therapy for T1B esophageal adenocarcinoma. So far, comparison between endoscopic therapy and esophagectomy for T1B esophageal adenocarcinoma have mostly relied on the small retrospective studies. Additionally, while population-based studies evaluating treatment outcomes have been conducted, they included all early-stage cancers such as squamous cell carcinoma as well as the T1 stage, rather than focusing specifically on the treatment outcomes for T1B esophageal adenocarcinoma. Therefore, using the National Cancer Database, we conducted this study to identify the risk factors for lymph node metastasis in T1B esophageal adenocarcinoma and to evaluate the factors affecting overall survival and cancer-specific survival based on different treatment modalities. Our secondary outcomes were to examine the trends in the management of T1B esophageal adenocarcinoma with endoscopic therapy over the past decade and to determine the factors associated with the use of endoscopic therapy in these patients. From the SEER database, we included a total of 1,418 histologically confirmed T1B esophageal adenocarcinoma patients diagnosed between 2004 and 2018. Focusing on T1B N0 M0 staging, we divided these patients into two groups: 174 into the endoscopic therapy group and 769 into the surgical group. Among the 1,418 patients with T1B esophageal adenocarcinoma, lymph node metastasis was present in 16.1% of the patients at the time of diagnosis. Major risk factors for lymph node metastasis included poor tumor differentiation and lesion size greater than or equal to 20 mm. Endoscopic therapy was commonly performed from 2009 to 2018, particularly for elderly patients aged greater than or equal to 65 years and small tumor size less than 20 mm. Using a Cox regression multivariable analysis during a median follow-up of 50 months, age greater than or equal to 65 years, and patients who received endoscopic therapy and chemoradiation therapy were associated with poorer overall survival. Factors linked to decreased cancer-specific survival included age greater than or equal to 65 years, poorly differentiated tumors, and patients who received chemoradiation therapy. Our study has several strengths. First, the dataset is from a population-based cohort, making our finding more broadly applicable to the US population compared to the data from specialized or single-center studies. Additionally, our dataset included a large patient volume and a long follow-up period, allowing for a robust survival analysis to detect variation between treatment cohorts. Our data covers up to 2018 in the SEER database, which likely included more patients undergoing endoscopic therapy. However, we do recognize several limitations. The retrospective nature of our study introduces potential selection bias. The SEER database does not provide important prognostic factors such as provider information, for example, hospital volume or experience of the endoscopist or the surgeon, as well as specific surgical details such as methods of endoscopic treatment such as endoscopic mucosal resection or endoscopic submucosal dissection, open surgery or minimally invasive approaches, depth of submucosal invasion and treatment-related complication and the resection margins. Therefore, we could not adjust for these factors in our multivariable analysis. In conclusion, our study provides additional data on the lymph node metastasis risk and the treatment outcomes for patients with T1b esophageal adenocarcinoma and T1b N0M0 disease. The use of endoscopic therapy has increased in recent years, especially among older patients with smaller lesions, that is, size less than 2 cm. Endoscopic therapy is associated with worse overall survival compared to surgery, possibly due to its preference for older patients. But the cancer-specific survival remains similar between the groups, suggesting that endoscopic therapy can be a suitable alternative to surgery for carefully selected T1b lesions. The addition of chemoradiation therapy did not confer any additional survival benefits for these patients. However, large-scale studies are required to validate this finding.